We've received a lot of questions from you, very specific and very vague questions about coronavirus and COVID-19 and where we are as a state, as a nation, and things like that. And so we're hoping to provide some of those answers for you over the next hour. We've received dozens of questions, and we have a big list that we're going to try to get through, and hopefully you'll hear the question that you sent us and get the answer that you are looking for. I'm Bianca Castro. I'm the health reporter with NBC5, and I'm joined with four of my colleagues here in the healthcare business, if you will. Anna Kuchman is next to me. I'll let her introduce herself to you.
Hello, I'm Anna Kuchman. I'm a science reporter at the Dallas Morning News, and we're joined today by three physicians from the Dallas area. We have Dr. John Carlo. He is CEO of Prism Health North Texas, and he's former medical director for Dallas County. We have Dr. Mark Casanova. He is the president of the Dallas County Medical Society and a supportive and palliative care physician here in Dallas. Both Dr. Carlo and Dr. Casanova are members of the Texas Medical Association COVID-19 Task Force.
And then we have Dr. Bryan Johnson, who's an internist in Frisco. He's the former president of the Fannin County Medical Society, as well as an active member in the Texas Medical Association. All three experts are people that we've gone to over our reporting over the last few weeks, and we feel are very knowledgeable to help answer some of these questions. So the format of this will look something like this. We've organized the questions into sections, and if you aren't able to stay with us for the entire hour, then you should know that we are going to be posting this or keeping this live in our archives for you to come back to and visit over the course of the next months, years. This will probably live forever. So with that being said, we will go ahead and get started. We're going to jump right in with some COVID-19 origin, symptoms, and transmissibility questions. The first question is, when, where, and how did this virus originate?
So, I think one of the things that is remarkable is how quickly we figured out that something new had happened. And so this originated late December in the Wuhan province of China. And we actually had the virus sequenced. In other words, we knew the genetic makeup of this virus within a few short days. And then just 5 days later, we had a test for it. So we very quickly identified this new virus over in China.
Great.
So another question from a reader. From the time that someone contracts the new coronavirus, how long before they are contagious and how long before they are symptomatic?
So our current understanding and what we've learned from areas around the world that have predated our experience in the U.S. is that symptoms tend to set in about 2 weeks. So we refer to that in medicine as an incubation period. The reality is the acquiring of the virus, the infection, so to speak, means that individual is likely contagious or can spread virus to others in that entire time frame of 2 weeks. Now, certainly when somebody becomes symptomatic and they're coughing and sneezing and having upper respiratory symptoms, they're shedding even more virus at that time. So our current understanding is there's approximately a 14-day, give or take, incubation period, during which time the individual has potential to spread the virus, and then, of course, the infection phase itself.
What are the first symptoms, and how does it progress?
Normally it begins with a cough, fever, and in advanced stages you start to become short of breath at that point. Recent information that has come in shows that diarrhea can be a component of that, but that's not the thing that you would see initially. That may be in an advanced stage of the illness. But those are normally the three first symptoms that you see.
And how can people distinguish between the initial symptoms of coronavirus and something like seasonal allergies or the flu?
Well, that's a tough question. These symptoms are very nonspecific. So, particularly fever during the flu season right now, it's probably flu. And unfortunately in Dallas, we're still seeing flu. So these are very nonspecific symptoms. I think the big thing is fever and cough. Could be influenza, could be coronavirus, could be the common cold. But those are things that we're challenged with in this circumstance.
The other acknowledgement to what my colleagues mentioned as well is acknowledging there are individuals who are in fact not symptomatic. Those tend to be the younger, healthier individuals. So I think we also need to understand that, which is one of the reasons behind social distancing, separation, and just being mindful and careful.
I'm going to lump these two questions together. How long does the illness last, and how long would you be contagious?
So we were consulting together ahead of time, and we simply don't know the answer to some of these questions, and that's going to be one of the realities. I think we're going to be asking and looking to our communities and to our public to understand that we're all in this together. This is an extraordinarily steep learning curve. We have pretty good sense of how long it takes for the infection to manifest itself, that incubation period of about 2 weeks, how long infection is lasting. We're seeing estimates of a week to 2 weeks. It obviously depends on the severity of the illness. What we can't answer is how long the individual remains infectious as of now. That's going to fall into the category of more news to come.
I just wanted to ask one quick follow-up question about how quickly symptoms start. I've seen other estimates that say that people can become symptomatic in 3 to 5 days. So is it a range, like 3 to 5 to 2 weeks, or is 2 weeks more accurate?
I think it's two things. I think it's a range of an incubation period, but more specifically what we're seeing is some individuals who are more susceptible, have underlying medical conditions, their illness seems to progress quicker. So I think that's where the 3 to 5 day comes from, the onset of the first sniffle, upper respiratory indication that something is awry, and then to more serious illness.
Okay. And then what are some of the long-term effects of having had COVID-19?
We don't really know. I think that this disease is in its infancy, and there's much to learn about this disorder, this disease, and so that's yet to be determined.
Yeah. The next question, can a person contract COVID-19 twice?
That's a good question. I think from a theoretical standpoint, no. I think that the answer is most people would say if you've recovered, then you're going to be immune. However, this is such a new situation, we can't say for sure. Now, the other part is viruses change over time, just like influenza does. And so, it could be that the virus changes and then you would be susceptible to another infection. But most of the time, if it's the same virus, you recover, you are immune.
Is the virus airborne?
So that's a great question. I think the way I would answer that is we don't know for sure at this point. The definition of airborne, though, is an exact criteria as we might think it is. I think the way we are looking at this is like most respiratory viruses, just like the common cold, other coronaviruses, droplet spread, which is really those coughs and sneezes, the actual wet things that come out, don't travel very far, are really the predominant way that coronavirus is transmitted from person to person. So that's why we're saying 6 feet is a general guide to be safe. And so do we know for sure about the airborne risk? We don't, but we think that the bigger risk, of course, is coming into direct contact with the droplets.
Correct.
Do you agree?
Yeah, touching surfaces and the like. So a droplet travels in the air, but then the risk is it landing directly on a family member or on a surface that somebody comes behind and touches and rubs their own eye, for example.
And then on the surface, it can be the virus can be active, to our knowledge so far, up to 3 days.
Yeah.
So decontamination of surfaces that are commonly used is essential to helping to decrease the spread of the virus.
Okay. Does the virus always make its way to the lungs, or is it possible to just infect the nasal passages and throat?
Most viruses are going to have a portal of entry, either being the nose, the mouth, the upper airway. There are going to be subsequent effects on the lungs and effects possibly in the entire body. For example, if you're having a fever, you're going to feel that all over. So it's not that the virus has to get all the way down into the lungs to set up shop. It's going to set up shop if it finds its way into the human body, typically, again, through our mucous membranes, nose, mouth, and the like.
And so early on, we were told not to buy masks and that masks are not effective for people who are healthy. Has that changed at all as the situation has gotten more serious with COVID-19?
I don't think so. I think that what it is a good opportunity to use a mask for is if you are showing signs and symptoms. In other words, if you are coughing and sneezing and you do have an infection with COVID-19. putting on a mask will prevent those respiratory droplets from coming out very far. And so there is a good prevention measure if you are sick with corona-19, but if you're asymptomatic or you're not showing any signs or symptoms, I don't recommend it. I don't know if you all do.
No.
Dr. Johnson, you just touched on this a little bit. So we're talking about touch screens and keypads. Can the virus transmit then through those kinds of surfaces? For example, if I need to go to the ATM and get some money, should I be wiping down a keypad before I touch it?
Theoretically, it may not be a bad idea because it could potentially, if an individual with COVID-19 had used that device within 3 days and contaminated that device, then yes, theoretically, you could receive the virus or could become infected by using that device.
But just as also, though, another solution is just because it comes in contact with your hands, you can wash your hands or use hand sanitizer.
Correct.
So,
That's true.
The other benefit is, just because it comes in contact with the skin on your hands, that doesn't mean that you're going to become sick with it. So that's why hand washing is really important.
Correct.
That's true.
Can your pets give it to you or catch it from you?
I don't think we have a clear answer on that yet. So that falls into the more to the come category, but no clear evidence of pet transmission or animal transmission at this point. Is that fair to say, John?
Okay, you talked about the virus transmitting through our nose, our mouth, our eyes. Can the virus penetrate unbroken skin?
We don't think so. This is a respiratory virus, and typically this is not, a skin or unbroken skin is not a way that this virus would enter the body. So I think you're safe in those situations. Again, general good hand washing, and the big thing again is to avoid touching your mouth, your nose, and your eyes. It's the hardest thing to do, but that's probably the best way to prevent yourself from getting sick.
If someone sneezes or coughs in an apartment hallway, how long can the virus stay in the air?
Droplet transmission, if you will, in the air is typically short-lived. From a classic droplet transmission standpoint. So let's emphasize that. So droplets into the air, pretty soon they evaporate, and the virus doesn't have the ability to stay suspended in the air. From the mechanism of transmission for most COVID viruses.
Yeah, I don't think very long. I think that the bigger risk, of course, is coming in direct contact with the wet droplets or touching an object that's been touched or has those materials on them. I don't think that the long, sustained airborne risk is there.
So if you begin to have some severe symptoms, such as difficulty breathing, should you call an ambulance or be taken to the ER?
The answer is yes, and frankly, it's the question posed, is it an either or? It's probably both. First thing to do is if you have a healthcare provider, give them a call. Okay, notify them of your symptoms and severity. They may have a mechanism to direct you in an expedient fashion. If you are in significant respiratory distress, fancy way of saying having marked difficulty breathing, you need to get healthcare as soon as possible. Our ask would be that you notify 911 when you make that phone call that you are having upper respiratory difficulties, you're having difficulty breathing, and so that our EMS personnel, our first responders, can be prepared for that. Same thing for the ER. That's the purpose of calling the emergency room ahead of time, make them aware that they're going to be receiving a loved one who may have potential for carrying COVID.
And when we say shortness of breath, the way that I always tell my patients is that if you are unable to complete a sentence in speaking, if you have, as the airways become inflamed, the air that is moving through that airway makes a musical note, which is a wheeze. So when you get a tight airway, then you're going to create this sound, and it's a wheeze. If you're developing those types of symptoms, and if it's labored, if you were really pulling air in or having difficulty breathing, and you're using a lot of energy, or you really are struggling, if you're really struggling, that's when you should notify somebody. And if that's the case, you probably should contact emergency service and let a family member know that you're having difficulty as well, because you're probably not going to be able to manage yourself at that level. So it may be beneficial to have someone that you have a contact with or can contact to assist you in that situation.
Absolutely.
If you do contract COVID-19 and you're able to stay home and take care of yourself, how should you treat it?
Well, I would treat it just like when we've all had the flu. And we know the important thing is, number one, rest. You really do have to take time to get your body to heal. Adequate fluids, symptomatic treatment of, the fever and muscle aches and things like that, decongestants, things like that, all practical stuff that we know how to do. Again, common colds and flu are very common for us. We all go through those experiences, so just use the same guidance in terms of how you would take care of yourself at home.
And then also beyond yourself, having your family plan in place. So if your family plan consists of equally healthy young individuals, as much physical separation as possible. If your family under your roof includes an individual who has compromised immune system, elderly, then having a family plan in place about how to distance as much as feasible, understanding that grandpa may not be able to go to another location. Right. So just taking care of yourself, but taking care of each other as well.
One viewer asks, I'm hearing that we shouldn't take Motrin or alternate acetaminophen and Motrin to address fever if we have COVID-19. Is that true?
I don't think we have clear evidence on that as of yet. There have been a handful of case reports, but I think that falls in the category of we're learning more. Acetaminophen certainly is Tylenol, a safe medication to use for fever, and so it would be reasonable to expect that it should work for this.
And if a patient is hospitalized, a viewer wants to know, how are doctors treating this in the hospital without a treatment or vaccine? And do we have enough of this treatment until we get a vaccine?
So here's the reality. Treatment of an illness such as COVID-19 that we don't have a cure for really translates into as much support, what we refer to as organ support, for our patients and our loved ones. So what appears to be the predominant pathway that patients who have severe infection with COVID-19, not those that are going to do well with it, are they're entering healthcare facilities with respiratory symptoms. For many of those, if respiratory symptoms are so severe, they're likely going to need help with breathing. That comes from a mechanical ventilator, a breathing machine. And the approach is supporting that individual with medical support and to bridge them through that initial phase of the illness. So it's really supporting their body to the best of our abilities in that time frame.
And then we also treat the underlying illnesses, because you can get what's called secondary infection. So you can have a virus, and then because your body's immune system is compromised, you can develop a secondary infection. So much of that is what we're doing in helping to support an individual.
Okay, these next few questions come from a couple. They say they plan to give their bodies to science. They are part of the vulnerable population when talking about COVID-19. And so they want to know, what happens to the body of someone who dies from the virus? Can the body be embalmed, and can it be given to science?
So there is guidance on the CDC's website under the coronavirus webpage area that has specific information on management of deceased individuals and bodies. I don't have it in front, but I know that they're keeping that information up to date on the website.
That's good to know.
If I don't have a healthcare provider and fall sick, who do I call to receive medical care?
Well, currently, and anybody feel free to jump in, but currently there are numbers that various municipalities or counties will have established for calling in, reporting symptoms. Really the key is if I have mild symptoms and I'm curious of what my county's protocols are, testing capabilities, you're going to give that information. If you're sitting at home, you don't have a healthcare provider, and your symptoms are turning bad in a jiffy, you're going to want to go ahead and go back to the conversation we had earlier about contacting a local ER and or EMS, letting them know I'm sick and I'm concerned and things are getting rough, and go from there.
Our next viewer writes, how long do you anticipate this virus being prevalent in the communities, both with social distancing and self-isolation and without self-distancing or self-isolation and social distancing?
Yeah, I wish I knew that question. I think it's one that we want to know. We all want to know the answer to that. I think that a couple of things. One is the vaccine's important. So we're 18 months minimal, year, and before we can have a vaccine out. That would be one indication of when the circumstances change. There's been a lot of conversation about what happens in the summertime. Maybe this is going to be a seasonal infection, just like influenza is. And I don't think we know the answer to that either. And if that is the case, then if we do see it go away in the summer, then it's going to come back in the fall. And so we don't know for sure, but I think it's going to be around for a little while.
Say the best answer we can say is in the range of months. And that could turn into many.
But remember that what I tell my patients, it's what we're biting for is time. So if we can isolate those that are infected, allowing them time to recover, then they no longer are at risk for those who have not been, those are basically disease-free. So what this is it's a fight against time. So if we can continue to have extreme social distancing, it's probably, from the studies the analysis that have been done, it's probably the best method to help to keep people in clusters, and hopefully if you do that, you can prevent the spread of the disease. The problem becomes if you have individuals who scoff at the disease and think that it's a hoax or it's something that's made up. Those individuals are the most dangerous for us all, because they can then infect the clusters that we have already created, and then can create a worsening disease, because now you have people that are isolated in clusters and now becoming infected, and so it just does not, we don't know what happens by that model, to my knowledge. I don't know what that looks like, but it is real, and social distancing and the things we talked about are very helpful.
What is Dallas doing to increase the ease and availability of testing? Are there any drive-through testing centers being set up?
So I think it's an important point to start off with is how the test is done. So remember, it takes a swab to go in through the nostril into the back of the throat. It has to be done under very careful technique. So there's the test, and then there's the way that the test is completed. If you've had that, it's called an NP swab. If you've had a rapid influenza test before, you'll remember that's quite an uncomfortable test to have run, but that's what you have to do to get a coronavirus test run. So in addition to where you would go to get the testing done, we have to figure out where you would go to actually get the swabbing done. And that's just really a question we're trying to learn ourselves. You know, most doctors' offices do that test because you're also looking at strep throat or influenza at the same time.
And when you say do the test, they obtain the swab.
They obtain the swabs, but
Right.
many doctors' offices are not doing this for the coronavirus test.
Correct. And another key reason is that the equipment necessary to don and to have on board or on the tester is much different than just a flu swab or a strep throat swab. So those are multiple factors that are going into current planning.
Right. But I think the other point on that is we're worried also with the lack of testing to not have, if you do have strep throat or you have flu, there are treatment for things that can cause very similar symptoms. So at the same time, there may not be a coronavirus test available. You don't want to sit on flu if you could go and get, you know.
Right.
So I'm hearing some doctors are actually doing preemptive treatment. In other words, just writing prescriptions for Tamiflu or other anti-influenza medications without the test because
Provided
you can't.
the story is very consistent
Yeah.
and sounds much more like flu.
Right.
Right. So there's some things that we can do differently. But again, you know, this is part of the challenge where we are right now, and it's not just about getting the coronavirus test. I think that's kind of simplifies the problem.
I agree.
I agree.
So this kind of leads into what you've been saying. Where can we actually send patients to get tested? We keep hearing that non-hospital facilities are testing, but we don't know where exactly. Our own healthcare workers with risk factors don't know where to go.
Yeah, I don't think there is an answer right now. I mean, I think there is a lot of individuals that I know want to get tested or going out and looking for that. And I don't think we have a single place to go to refer. You know, hospitals do the testing, but they're limiting that for severe cases, people that are really sick or in the hospital. Health department really is only testing for surveillance purposes. So they're not really testing to really help individuals find out whether they're infected or not.
The majority of that reason is just the capability.
Yeah, there's not a volume.
The
You can't
capability
handle it.
of the equipment and the testing capabilities through the county health department. So again, and I think this is really not just a Dallas County or North Texas specific issue. We're hearing at state and national levels, yes, testing is coming, testing is ramping up and rolling out. I think the key is that there is truth in that. The ability to take a specimen, put it in a machine, and get a thumbs up, thumbs down answer from an assay that is run. But one needs to collect the sample, and it's the sample collection that is being worked on by many as we speak. And again, this is real time unfolding, and I'm sure more information to come in the coming days.
But there are several private labs that are running the tests for us. We have about 5, I think, that may be pending.
Yes,
now.
who are performing the analysis.
Yes, that are
It's
performing
it's getting that swab there.
Yeah, you
That's-
can get the tests if you order it, and a lot of doctors will have that capability. So you have to have the test run. You have to have the sample taken, but doctors' offices generally can send them to commercial labs for testing. The question is whether the doctor's office has all the personal protective equipment and all the necessary materials in order to do that testing.
Okay. And we did report early this morning that Parkland Hospital is setting up a drive-through testing facility, which should be open later today. But you need to be a Parkland patient and have an order from your physician before going. Why haven't Dallas County officials recommended that we cancel all non-urgent outpatient clinic visits? It seems very irresponsible, this reader writes, that clinic visits are discontinuing as usual and patients are sitting in crowded waiting areas. Unnecessary potential exposure to the virus for patients, families, doctors, and nurses.
So I'll take a stab at it because we've been asking this in our own offices. I think rather than at a county level, that has to be at an independent physician level and an office level. For example, we have HIV clinics that routine visits we really need those ongoing routine visits. You can't really say that this is not an essential visit for that particular patient today. We're working on strategies maybe to delay the visit or reschedule and do some of those things, but we're handling that on a case-by-case basis. And I wouldn't want to see a county-wide recommendation, because I think we have to do that on our own to make sure we make the best decision for our patients.
And I think there's a much broader component to the on our own. So you have cancer offices, clinics, transplant clinics, where those individuals are not going to be able to just not go into the office. However, if that individual also goes to a primary care office, do folks with stable medical conditions defer those visits? You're not ill, this was a well person checkup, does that get deferred? So I think those are some of the decisions that are being made both by physicians' offices, healthcare systems, but then also we would ask the public to make that own decision for themselves. Do I absolutely positively need to go in for this physician's visit? Can this be handled by what we refer to as telehealth, which is a large category of means of accessing a physician's office? And then what rules are being implemented? We're hearing that on a national level as well.
And I think that another thing that can be done is that if you can call ahead to some offices, they will already have protocols established on how to treat patients who are complaining of things as simple as the common cold. And so those patients will, in some offices, are relegated to specific parts of, or you have a different protocol set up for that individual. They may enter an office through a door that may not be accessed that often, and you can not quarantine, but you can separate those individuals from those that may be coming in for renewal of medications for hypertension, for example. So there are some things that can be done where you can follow the CDC guidelines, and you can set up an office where you may not commingle diseases like that. So it's thinking that for that individual, thinking that they may be in an office with someone who's sick, at this day and age, many offices have already thought that through and have made concrete decisions on how to treat those individuals. So you may not see that.
The other reality that we as healthcare providers face, whether it's an office setting or a hospital, is other diseases don't stop in the time frame of pandemic. Heart attacks still happen.
That's right.
Chemotherapy still needs to be administered. So it would be great if we could push the off switch, but it's just not feasible.
Right. This next question comes from a psychiatrist who does a lot of psychotherapy. He writes that he does some telemedicine, but face-to-face is really what he needs to do for his patients. Is it okay to still take patients if I'm cleaning my office well?
I think it's a good question to kind of answer with some practical approaches. We're simply not going to be able to just cut off everything that we do and exist in complete isolation. You know, we can limit the mass gatherings, we can do what we can to, you know, wash our hands more and those kinds of things. In this example, I think there are practical ways to continue that office visit safely. You know, first is, you know, a patient definitely shouldn't come in that situation if they have signs or symptoms. So you'd want to put a sign out front in the waiting room. And most doctors' offices, I think, probably already have that
Yes.
done. You know, 6 feet is really that good guidepost. So if you, as long as you stay 6 feet away from somebody, like we're nearly what we're doing here makes sense as well. And then cleaning the environment. You know, the high-touch areas, the doorknobs, the equipment that's commonly used. So I think there's some sensible things we can do without completely cutting off those essential things that we do in our community.
And a two-way approach also of the physician or the clinic inquiring of the patient coming in, how are you feeling today? Any worrisome symptoms? Any worrisome known exposures? And then the individual themselves who realizes, listen, I think I'm coming down with something.
Yeah.
I'm going to go in and call my PCP,
Yeah.
report
Right.
in,
Right.
and decide what to do from there.
Is there any way to tell if you have had the virus and are now over it?
I would say likely not without a test to confirm that you have the antibodies, so unlikely.
But when more testing becomes available, how far back will they be able to detect, you know, will they be able to tell that you maybe had it a month ago or a couple weeks ago?
Generally, I don't think we're going to know. That would require an antibody test, and I don't think we've seen
Right.
anything related
Right.
to an
Nothing,
antibody
yeah.
test.
Right. And I think to that subtle point, and it's a great question because it raises the issue of, okay, when testing capability does come online, there's still going to be, really what we're facing right now is a prioritization. We're prioritizing those who are entering our healthcare facilities who are in extremis, in crisis, and obviously very clearly ill, then contact individuals, those with high-risk exposures, healthcare providers, EMS, first responders. So you're going to see a trickle-down effect even when testing is adequately ramped up.
Okay, I'll ask this next question, although I feel this answer changes day by day and will be different by the time we get to the end of this week. How well is Dallas, and let's just say North Texas, prepared for testing?
Well, I've talked a lot that Dallas and North Texas is far in front of other areas because of our experiences. You know, this community had the consequences with Ebola, and we've had West Nile outbreaks, and so we are not new to this. As far as the testing, we do have a great public health lab that's really was one of the first in the state to really set up the surveillance testing. Now, they can only do about 250 samples a day, I think is what they're talking about, and so it's not enough. But I do feel we're certainly better off and we're further along because of our past experiences and what we have in our community.
And you touch on something, John. I think it's the emphasis that there's the testing issue in North Texas, and it's also our ability to manage this and to deal with it. And I think that is where there's a great degree of what I would call legitimate confidence in our abilities to manage this and handle it, and with the leadership we're seeing in multiple venues, independent of the testing bottleneck we have.
And then a couple of questions about how to kill the virus. Would an ultraviolet black light wand kill it, and does dry cleaning kill it?
I personally do not know the answer to either one of those, but you can go to the CDC website and probably have much more affordable options than a ultraviolet wand to clean the virus on high-touch surfaces in your own home.
I mean, yeah, that's dry cleaning probably, but I think the big thing is we do know that there are, you know, for surfaces, that's the big thing. We know how to wipe down surfaces
Right.
with effective cleaning agents. You know, there's definitely things you can do in that regard.
And someone sent me a message on Instagram. Does gargling salt water kill the virus?
No, it does not.
No.
If you have a sore throat, it's going to help you symptomatically, but it won't do anything to help the virus.
Okay, great. Well, you touched on this before. I've heard that this virus cannot survive the warmer temperatures. Is it true, and can you expand on the details? And I guess the answer is that we just don't know.
We don't know, and you know, I was also talking about, you know, in Dallas in the summertime, it may be hot outside, but it's going to stay cool inside our homes. And so just because the environment outside changes doesn't mean that we're completely limiting cooler temperatures.
And also with a virus that has changed like this one has, one needs to be cautious about making predictions of exactly how it's going to behave, despite the fact that it's still in the COVID family.
Right.
Is it going to be a black sheep and behave differently?
Yep.
Okay.
So the SARS question. So one reader was kind of asking, about SARS. So SARS was another sort of threatening pandemic, but then it kind of went away. So
Right.
how did that go away? And could this sort of,
Right.
could something similar happen now?
Right,
with
so
COVID-19?
SARS and coronavirus, they're very related. You know, they're very, very similar. And so we've been looking at that experience in 2003. What ended up making the end of SARS happen is we were able to get in front of the next cases because the incubation period is relatively long. And so what you were able to do is actually find all of those that were exposed or who had become infected and actually kept people in isolation, and it prevented it from moving forward. This one's a little different. It's more infectious, so it's harder to get out in front. You know, from what we've seen so far, it's definitely a different in terms of how infectious it is.
And that goes back to when viruses change, when they undergo what we refer to as shift instead of drift. There's a very abrupt change in the behavior. It can impact the transmissibility of it. It can impact the degree to which it impacts individuals' mortality rate and the like.
One person asked me earlier, why is it okay for daycares to stay open but schools close?
That is a great question. I think that the way I would answer that is this is an overall community strategy. So we do know that schools have the highest number of individuals coming into the closest contact. So remember, a school classroom not only includes that classroom, but the school itself. We're talking about hundreds of students. Daycare centers are much smaller in terms of the size. So while the individual distancing may be less, it's a broader question of how many people are coming into those environments at one time.
This reader says, I have a dentist appointment, and I'm wondering, is it safe to go to the dentist or not?
I think goes back to those same questions about going to your primary care doctor for a routine high blood pressure follow-up. I've not been to my dentist in the last week, but I imagine they're going to have the same signs that we do in physicians' offices and everywhere else. So again, if you don't feel safe in the sense of I'm developing some symptoms, don't go anywhere. If you have concerns, you're going to need to make those decisions on your own.
Follow-up question. A dentist sent me a message earlier. Should she be practicing right now? Should she keep her office open?
You know, I mean, these are great questions, but I do go back to we have to do what's practical. And, you know, the challenge I would have in that specific situation is we don't know how long this is going to last. So if you close now, how long do you stay closed? Because I don't know how we would open back up again. So I think the better answer is to be practical in the approach. You know, perhaps, you know, staggering more appointments, having fewer appointments, you know, definitely signage out of the waiting rooms, extra cleaning, extra precautions. You know,
And I think you may need to do that. I agree, because I think that you probably could maintain your practice, but you may have to stagger those appointments because we're even learning that it takes a long time to sterilize the room again. And so that's something that needs to be taken into account, how well you do that process. And so you may have to change your schedule. You could probably stay open, but you will have to, you know, you will have to change how you practice, but you can still practice.
Absolutely.
So these next few questions are about traveling and seeing friends socially. So Robin from Denton wanted to know, you know, I have seen the warnings for older people to avoid travel. Should I be concerned about traveling to visit my out-of-town elderly parents? They are in their early 70s and in good health.
You know, I'm getting a lot of these questions too. I'm sure we're all getting these. These are highly individual decisions, I think, at this point. You know, you have to judge that based on not only the age question, but also the overall health of individuals. And then I ask the question of how essential is that visit? You know, if it is something that perhaps could be delayed, maybe that's the right answer. You know, but I do think it's important to think about it. I think you've got to take it on a case-by-case basis.
And I think it's going to be a situational answer. So our answer to that today is I would fully agree with Dr. Carlo, but I think we need to be aware that that answer is going to change in the coming days and possibly to weeks as our situation changes here in North Texas. I will just interject because I thought it was a wise piece of advice. in the potential of school closures and or prolonged spring breaks, whatever the case may be, one of the questions are, well, play dates. And I think that should be something that really would advise against in those situations. So our children, not to blame them, but they're wonderful vectors of infection, as beautiful as they are. And I think we need to be mindful. And you may not have that elderly patient or parent to go visit, but your neighbor does, or that child's friend's mother is ill. So we just need to really be thinking about it from that perspective.
This viewer writes, how safe is it to go to the store? There are very large crowds there right now. And how often is it okay to go to the store if you're trying to self-isolate?
Well, we're going to have to go to the store eventually,
Yeah.
right? So I think that there are ways to protect yourself when you're in these environments. I mean, this goes back to hand washing, being wary of surroundings. Don't touch your mouth and nose and eyes when you're in those surroundings. And we're going to have to get groceries. We have to do that. Picking off hours when it's not as busy. I would do that. I do that all the time anyway. I mean, I think there's some sensible things you can do. If you can wait a little bit, I think that this will calm down.
This will calm down.
But I think, inevitably this goes back to you have to be practical, and we're not going to be able to shut down everything.
Right, and actually, my grocery store was fairly quiet yesterday because there wasn't a whole lot there. From a personal and societal responsibility perspective, that's our other ask of the community is, 3 months worth of you name the item is probably not necessarily. I think we want folks to pace this. I think we're going to be okay from that perspective, from a food supply, from a toilet paper supply perspective. We're going to be okay.
And then that reminds me too, we're trying to keep our distance from each other 3 to 6 feet.
Right.
Do you need to follow that rule when you're at the store or any other public place?
I would. I
Yes.
try to.
Yes.
Yeah.
I was talking to, that it's hard to stand in line because people don't realize you're standing in line, but we'll figure it out. It's something
Yeah.
we're going to need to do.
And I'm bearing witness to folks doing it on their own.
Yeah.
As I'm out and about, not too much, but grocery store, for example, or at the hospital, folks are really, I'm witnessing are being mindful and separating each other. So kudos to our public for taking this seriously.
And so if we don't need to get a 3-month supply,
Correct.
so like how big of a supply are you guys buying now?
I couldn't buy anything. They're all out. Really, in honest sincerity, probably what you need, really. And I think it's, there's been general consensus, and I think folks have understood the importance of social isolation to prevent disease transmission. Well, it's a downstream effect. You purchase 6 months or a year's worth of supplies or X, well, you just impacted another individual in another way. So we really are encouraging folks to do what we all should do, take a deep breath.
Yeah.
How much top ramen do I need? And is 1 week okay?
Yeah.
It's probably not healthy, by the way.
But I think there's some general guidance. So this isn't just about the coronavirus. This is general preparedness, and we have severe weather in Texas.
Correct.
We have anything else that happens. And, it's always a good idea to be prepared with your house, to have food on hand.
Right.
What I've done is really just added a few extra days when I made the trip.
Right.
And
Rule of
just
thumb,
slowly
2 weeks supply.
just start adding it up just so you have enough. Because you just don't want to have to be stuck at a point where you're out of food and you got to go to the grocery
Correct.
store and it's the busiest
It's
time
empty.
of the year. Or empty. Yes.
Okay, some general travel questions. Is it safe to fly within the United States? And I'll take that one step further. Is it safe to take a road trip anywhere?
I'm going to answer the flight question really easily, or briefly. I'm going to pass it to my colleagues. The rationale for restriction of flights from hot zones, so to speak, is that coronavirus lives in that hot zone. Well, coronavirus is here, so I think when you're making your own personal decision about flight travel, I think we need to kind of keep that in consideration. And so, where is my flight? Is it to Washington? Is it to Northern California? So those are the considerations one needs to consider.
Yeah, I think that first knowing the process of flying, that you're in a busy airport, you're on an airplane, you're going to be around people, and a lot of times you're going to have to be in less than 6 feet distance, right?
Correct.
So it's, but do you have to get into that situation and why?
Right.
And that's the question we all have to ask.
And who are you? If you are an individual who has underlying medical conditions of concern, recommendation is going to differ from another individual.
Yeah.
And a series of restaurant and food questions. Is it safe to go to a restaurant or to get food from a drive-through or takeout, or to get takeout food?
Right. So yes, restaurants, I mean, the main rule, again, is about the distance between individuals. So if you can stay 6 feet away from one another, you wash your hands, I think that's generally okay. Yes, I think it's safe to take out. No food does not actually have its own way to transmit coronavirus from person to person.
And I think, that's one of those situations that is likely going to be a fluid situation. If we look at other cities and municipalities across the U.S., they are making decisions to close venues. And so, again, I think it depends on the degree to which concern is viruses in that community.
Again, that goes to the increasing your aggressiveness with social distancing. That's basically what that's done. It's not the preparation of food is fine, but it's just keeping clusters of people, preventing people from getting together in large groups. That's really what you're doing.
So takeout and things should be absolutely
that should be fine.
A lot of people are coming home from spring break. Frisco ISD had its spring break last week. You're in Frisco, Dr. Johnson, and some of these families are coming home from places that are now shut down, like the ski resorts in Colorado. Should families be self-isolating if they came from one of these destinations?
Again, much of what we've said before, if you're not showing symptoms, I would carry on with life as usual. Now, with that being said, the things that we talked about, hand washing is critical, and performing good health hygiene, if you will. But I don't think that if you're not demonstrating any symptoms, nor are your family members demonstrating symptoms, I think that it's okay. I don't think you need to put yourself under self-quarantine.
No, I mean, the only question is a visit to the grandparents necessary right after you've come back? And, I mean, that's a judgment call. I mean, it's an individual question, but you want to make those considerations, and if you are going to maybe visit grandparents, maybe you watch hands, hygiene, all of that other thing. But, so that we're getting a lot of those questions with people coming back. Again, signs and symptoms probably means you're in the clear, but just being mindful of who you're going to be around afterwards.
And I think also, why was the locale that you were at closed? Was it a precautionary precautionary measure that a place instituted, or was there active infection there? If it was a precautionary measure rather, then
It's a different story really at that point.
Right.
Here's someone who's right in the middle of moving, and she would like to know, what do you recommend at this critical point when people you don't know need to enter your home? I would be considered a middle risk patient.
Well, we can't give up. I mean, these things are happening, and it's a great question. I think first it goes back to individual protections and precautions. So you can protect yourself in just about any environment by washing your hands and, preventing yourself from touching your mouth, nose, and eyes. Common areas that are now being touched by other individuals, it's a good thing that you're going to have to do is clean those areas. I think you can do it. I think it's great to be wary about it, but I think you can do it.
Now we're going to talk about some of these workplace questions. I know a lot of people are being told to work from home, but not everyone. And so this person writes, I sit next to 2 coworkers who are consistently coughing and sneezing, which makes me feel uncomfortable, but not sure how to handle the situation with my employer. Should I go to my employer to see if they can move me or send me home?
Well, that is a tough question. I think you really, if you're in that situation, you need to talk to your human resources person, because that's something that you're going to have to take on a case-by-case basis, and employers are going to have these procedures in order to follow that sort of an environment. So that would be my advice, is to talk to your HR person.
ask the folks to cover their cough, to cover their sneezes. I mean, multiple things there to unpack.
Kind of a related question is this person is saying that schools are closing and people are starting to bring their kids to work with them. Is this wise?
Well, I mean, I think it goes back to what we've been talking about. The purpose for social distancing is to limit the density of human-to-human interaction. And so if we've closed the schools, that's the major, most socially dense environment that we are in our communities. Does that mean you close the schools and then result in an increase or a decrease in distancing elsewhere? That's what that sounds like to me, and that would be something to be thinking about very carefully. I mean, I don't think the intent of school closures was to then have kids to enter into the workforce areas or new environments. So I think it almost defeats the purpose a little bit of why we're having to do this.
And I think this case speaks to the realities that families face.
Yeah,
In an ideal world, it's close the school, kid who stays at home.
Right. we
But there
can't
needs
all
to be
do
a
that.
parent, there needs to be a caregiver. So those
Yeah.
are just all the realities we're facing right now.
Yeah.
So we've heard from a number of readers and viewers with different underlying conditions. They've had organ transplants, they have autoimmune diseases for which they take immunosuppressant drugs. What are extra precautions that these patients need to take right now?
Really avoidance. I mean, that's a key piece of advice is avoidance of others, identifying a very small group of care providers, family members that are assisting them in their needs, in their food supply, whatever the case may be, maybe one or two individuals. But it's really, aside from maybe necessary doctor's visits to help continue to manage their medical conditions, really for them as much isolation as possible, and also separation of family members and others, is keeping those visits as minimized as much as possible.
I think that hand washing is something
Yes.
that I've learned is and we've talked about it before. It's a skill that's really overlooked, and so what we're doing at our office right now is, I was about to touch my face. Any patient that is that comes into the office, we're showing them how to clean their hands.
That's great.
And I think that what we do is that we make sure that they understand that they need to get under their fingernails and to do it on both hands, and also introduce and make sure that you're taking care of the webbing, because when you're washing your hands, there's a tendency to, when you wash or bring one hand over the other, the webbing, it's a divot, and you miss that. And so back to our surgical days, I teach our patients how to even put their hand under the water to make sure that the soap and the debris that you're using comes down your arm, not your arm, but at least the base of your hand, in order to do that. And it's a skill that's overlooked. So when we're talking about washing your hands for 20 seconds, it was, most people are like, well, I can do that in 3.
Right.
But that's not what we're talking about.
That's right.
We're talking about something that's a little more sophisticated, and I think that communication is lost on people. So when we say to those who are immunocompromised in one way or another, those individuals, we talked about their avoidance and everything, but also those individuals who may be closer to them, their family members or caregivers, should know these tasks. I had a nurse in my office last week, and as I was going through that, she's been a nurse for some 40-some years. When I went through that, she was like, I don't even do that. And that's something that even in our own community we can do. And that is essential right now for helping it's the best we can do to help to prevent the spread.
There's some good YouTube videos that we can show on how to properly
We
hand wash.
have at DallasMorningNews.com
great.
a great video with a registered nurse on
great.
how to wash hands.
That's great.
Yeah, great advice.
Yeah.
Everybody go to Dallas Morning News and look at how to wash your hands.
Well, we
Wash
have a
those
lot
hands.
of pregnant and breastfeeding mamas out there, and they're concerned. First of all, pregnant women are always considered high risk. Are they at high risk for COVID-19? Can the fetus be affected? And then for the breastfeeding moms, if a breastfeeding mom gets sick, what should she do?
I don't think
Great
we know.
question.
I think,
I
I
don't
think it's too early.
Yeah.
I share the concern that there is always a risk in pregnancy, but I don't think we've seen anything we look at.
And I want to share this with Kosh. We'd all have to, as medical experts, go back to our available literature that has come out of China and come out of Italy, in the myriad of things that we've all been reading, and the blast and wave of information that is coming our way. I do believe there have been some reports of successful deliveries of pregnant women, but that's going to be one of those moving target questions. We would look to the CDC for up-to-date recommendations and information about that.
So I think we'll just try to get in just a couple more questions in the time that we have left. So we heard from a veterinarian who has been giving dogs coronavirus vaccines for years. And he writes, why can't scientists come up with some kind of cocktail using the canine vaccine and give it to humans? Animals and humans have a lot of the same medicines, so I'm sure the idea has crossed someone's mind.
And it's a wonderful idea, but unfortunately, it goes back to the same notion of, well, why can't we sort of dovetail the flu vaccine and make it the coronavirus vaccine? Different viruses. Also, an acknowledgement that different viruses can affect different species in different ways. So it's likely a different coding to this virus that we're giving to dogs and cats or whoever we're giving it to. And that's the key with the vaccine, and that's why this isn't an overnight answer for us.
Right.
The vaccine has to match every aspect of this particular COVID-19 to be effective.
Right.
So that's why.
I think the other thing is, while animal vaccines are safe and they're good vaccines, this vaccine would have to be given to millions and millions of people. And so it has to be exquisitely safe before we can issue it out safely. So there has to be rigorous testing to make sure that vaccine not only works, but is safe in a large number of people.
Because what you could do is you can cause your immune system to go into overdrive, leading to pulmonary compromise.
You got to be careful.
Yeah.
I'm looking at our email box because just in the last hour we've received so many more questions, but we're running out of time. I'm seeing a lot of questions about what's happening that's positive. So are there treatments or clinical trials currently happening, or is there anything positive happening that we can look forward to?
Well, first positive thing that comes to my mind is more folks are washing their hands, and I think we've, as a society, are much more mindful in caring for each other.
Yep.
On the therapy front, there is research into assessing if any available antivirals have any meaningful benefit. We are weeks to months behind, depending on whether we're looking at China, Korea, Italy, and others. So healthcare professionals, researchers, scientists are working feverishly to try to determine, is there anything that's effectively working in these cases? And I guess the other positive is that, yes, this is a concerning situation we're facing. There's no doubt about that. But the experience continues to hold in the sense that the majority of individuals who acquire the infection do well, have low symptom burden, and will recover fully. It's that smaller population, which is a large number, that we're most concerned about.
Mm-hmm. Right, 85% right now is what we believe. 85% are going to do fine. And so I think we should celebrate the fact that this does have a high component of people that are going to do just fine. Mm-hmm. I think the other thing is how quickly we did find a good test. While we are still wanting more of the testing to be available, SARS, we didn't have a test for months. HIV, we didn't have a test for years, and so to think about where we would be without the technology to have even the test where we have it today, we wouldn't have any knowledge about what was going on without the test that we have.
Good. Do you have any last questions?
No, I'm glad that we ended on a positive note. Mm-hmm. So thank you very much.
Thank you.
Okay.
Thank you.
Everybody be safe.
Thank you.
Yes.
Wash your hands.
Yes. Thank
That's
you
right,
for
wash your
joining
hands.
us, everyone. And we'll try to do another one of these soon because we know that there are still so many questions that you have out there, and we will do our best to answer them. Thank you for joining us again.